Ready? Good afternoon. Thank you for tuning in to this community briefing on COVID-19 and our local response efforts. Joining me today again is interpreter Francis Beauvirage. Thank you, Francis, for being here to provide your important services for our community. And we want to remind everyone, of course, that we have additional information at covid19.lincoln.ne.gov, our city website, where you can find ways to protect yourself, your family, and our community during this pandemic. For today's situation and update, we want to share that we've had one new case of COVID-19 reported today in addition to the 9 reported earlier this morning. So that means we have a total of 10 new cases of people with COVID-19 reported in Lincoln today. This means that in the last 3 days, we've had 22 new cases confirmed, and we've seen the total number of people who with lab-confirmed cases of COVID-19 go from 63 to 85. While that increase is, of course, concerning, our models have shown that the number of cases will continue to rise throughout April. It's one of the reasons why we've been emphasizing so heavily all the important precautionary steps, including staying at home and other measures to protect yourself all this month. And as we've mentioned in previous briefings, we've also expected that increased testing would result in an increased total number of people with positive cases of COVID-19. Here to provide more details on these investigations by our local health department is Health Director Pat Lopez.
Good afternoon. The 10 new cases today are 5 women and 5 men, ranging in age from their 20s to their 80s. 2 Lancaster County residents are hospitalized at this time, and 1 is currently on a ventilator. Nebraska now has 1,477 cases and 29 deaths, with 1 of those deaths being in Lincoln. Our positivity rate is 3.7 for tests in Lancaster County, and the state is about 10.5, and the national rate is nearly 20%. I just wanted to discuss the increasing number of positive cases we are seeing in Lincoln. This is coming at a time when we are hearing about declining cases, hospitalizations, and deaths in other parts of the country. We want to remind everyone that Lincoln and the state of Nebraska did not see any positive cases until about 2 weeks after some of the outbreaks in other parts of the country. So it can be expected that we are seeing now what those other cities saw 2 weeks ago. The good news is that some of the larger cities may have hit their peak already. We will hit our peak as well. But again, we can expect to be about 2 weeks behind what's happening in those cities. Modeling shows that the number of new cases will continue to rise until we reach that peak. As we move forward, we should anticipate that most new cases will be community spread, which is why we're encouraging testing. This is a critical period of time to prevent more spread. We need the public to understand that this is serious, and we all must be part of the solution in reducing the spread of the disease. We should assume there is legitimate risk of exposure anytime we are out in the public space with other people present. That's why all of us should stay home as much as possible to prevent the spread of the virus. Although the risk of severe illness may be different for everyone, anyone can get and spread COVID-19. When you are sick or someone in your household is sick with symptoms, you should self-quarantine and isolate from others. Over the weekend, we saw the new cases in which people who live in the same household as someone with COVID-19 who were also infected. These cases are examples of what we call a close contact. This is anyone who is within 6 feet of a person who has COVID-19 for a prolonged period of time. If you are in that situation, it's important that you listen to the instructions from your health department and your healthcare provider. We identify close contacts through what is called contact investigations or tracing, as it's been referred to frequently in the news. Through our investigations, our staff notifies individuals who may have been exposed to a known case and provides information for what they should do. We will most likely advise them to self-isolate or self-quarantine. If you have a positive test or you have symptoms, you need to self-isolate to keep from infecting others. Stay home for as long as your doctor tells you, unless your symptoms get worse or you have to go to an emergency room. You should call ahead before you go to the doctor or the hospital. You should have no visitors, and if possible, stay in a specific sick room away from others in your own home. Don't share towels, silverware, cups, bowls, or plates with anyone else in your home, and stay at least 6 feet from others and wear a cloth face covering. If you have been exposed to COVID-19 and are at risk for developing symptoms, you need to self-quarantine. You need to stay home and avoid contact with other people. Self-monitor by checking your temperature twice a day. Wash your hands frequently. Don't share items. Do not have visitors, and social distance from others, and wear your face covering around them.
Thank you, Director Lopez. Testing is such an important part of our efforts, and we again urge all of those who are experiencing symptoms of COVID-19 to access the drive-through testing sites that are available through Bryan Health and CHI Health St. Elizabeth. These sites have the capacity to do 150 tests per day. We had 105 tests completed Friday and another 54 tests on Saturday. So as you can see, we absolutely have additional capacity to test many more individuals in our community. If you have COVID-19 symptoms, a cough, sore throat, shortness of breath, or a fever, we urge you to get tested today. All you need to do is fill out a simple online questionnaire at chihealth.com or at bryanhealth.com. The testing is safe and easy. Bryan Health is also getting ready to do some mobile testing that will allow them to travel around the city and to reach areas of Lincoln that may be underserved because of transportation access or language barriers. They hope to be in operation later this week, and we will keep you updated on their progress. Again, it is extremely important to stay at home as much as possible, to practice physical distancing, to wash your hands frequently and thoroughly with soap and water, to wear cloth face coverings in public, and to self-isolate or self-quarantine when necessary. Moving on to the next focal point of our briefing, we want to reemphasize our larger purpose in doing these briefings. We've been conducting community briefings since March 11th with several important objectives in mind. Initially, we periodically briefed the public on emerging knowledge and our understanding of this novel coronavirus, as well as on the CDC, the Center for Disease Control and Prevention, and local public health officials' best practices and guidance for preventing the spread of infectious diseases. In those early days, we hosted many of our community partners to discuss the significant cross-sectoral preparations that they were making along with the Lincoln-Lancaster County Health Department, those preparations being made to try to protect everyone, even before we had our first diagnosed case of COVID-19. In addition to communicating these best practices and community preparations, and again, even before we had our first incidents of someone in Lincoln officially being diagnosed, we focused these early briefings on changes that the state, our local health department, and our educational system partners were recommending and implementing in order to protect our healthcare system and our vulnerable residents from the eventual arrival of COVID-19 in our community. You may recall the day that we joined the Nebraska Schools Activities Association in announcing changes, significant changes, to the way that they held the boys' state basketball tournament in our city, and the early calls we made to you to work from home and to stay at home as much as possible. Once we had our first resident in Lincoln diagnosed with COVID-19, we immediately implemented and informed the public of new directed health measures. Then from March 27th going forward, we began briefing the public daily, Monday through Friday, in order to provide the most accurate, timely, and reliable information about the spread of COVID-19 in Lincoln and Lancaster County, so that residents could make important decisions to protect their health and the health of their families. With those same objectives of providing timely, accurate, and reliable information in mind, today we are unveiling a new resource for the public to view real-time data provided by our Lincoln-Lancaster County Health Department. Our new local COVID-19 data dashboard summarizes the status of this disease in our community. It's an evolving dashboard with additional components to be added in the coming weeks, but we want to unveil it to you today so that you can begin to count on it as another trusted resource and source of information. Here to discuss the COVID-19 data dashboard is one of the sharp minds behind it, Raju Karkalapudi, an epidemiologist with our local Lincoln-Lancaster County Public Health Department. And with that, I invite Raju to come up and give us a little more of the details about the dashboard.
Good afternoon. Thank you, Madam Mayor. I am Raju Kakarlapudi, Public Health Epidemiologist for Lincoln-Lancaster County Health Department. Today, we are unveiling COVID-19 data dashboard for the public. This dashboard will have most up-to-date information available and will be refreshed at least once a day. I want to thank our epidemiology team and our GIS team for their help in putting this application together. This is still work in progress, and we will be adding more data in the future. In this application, you will notice that we have many data points. One of these is the total number of lab-confirmed cases. The second is number of deaths due to COVID-19. In the bottom right corner of the page, you will see the case counts by week. These are number of positive lab-confirmed cases by week. This chart gives us number of positive cases that we are seeing. This also gives us an idea of whether or not the cases are increasing or decreasing. In middle of the page, you will notice a map that gives us geographic distribution of the cases. This tells us how the cases are spread out throughout Lancaster County. We are not divulging the exact number of cases in each individual zip code to protect patient confidentiality. In the bottom of the page, you will see the total number of tests done to date for COVID-19 and the number of tests conducted each week. You will see that we are doing more tests each week due to increased availability of testing. If you click on percent positive test tab, you will see the positivity rate is increasing each week. In the top left chart shows the cases by age group. This reflects the overall age distribution in Lancaster County. We are seeing COVID-19 in all age groups. In the bottom left, we want to emphasize the type of exposure in these cases. As you see in this chart, the majority of our cases are community exposure. At this point in time, everybody should assume that virus causing COVID-19 is everywhere in our community. Thank you. Thank you, Mayor.
Thank you, Raju. Just as a side note, obviously this is a profession for Raju and the team at our local public health department, but I will never forget the day we had our first briefing, and afterwards Raju looked at me and said, our lives just changed. And I know he was talking about the health department, but I think it was also our wider community. This dashboard took a lot of work, energy, and determination to create, and I want to thank him and his team and everyone at our health department who have been working around the clock since those early days to make sure that you all have the information you need to protect yourselves. This is truly a monumental undertaking, and we are so grateful for their dedicated efforts. Their lives truly did change not too many weeks ago, just as yours have. And now for some good news that we'd like to share. We want to thank the owners of the Hilton Garden Inn, managed by the Lincoln Hotel Group, in assisting our community and the city of Lincoln in providing rooms for our first responders and essential services employees. We appreciate the work put in by their staff, their manager, Melanie Thompson, and all those providing clean and comfortable accommodations for our brave personnel and first responders. In talking to John and Tammy Klimpel, members of the ownership group, they said that they want to do their part in helping the city as we endure this difficult time, and we are so grateful to them. We also have some exciting news from Public Art Lincoln. This is an advisory board that supports and provides support and guidance to the City of Lincoln on its public art collection. The organization wanted to find a way to bring joy and inspiration to our community while providing some financial assistance to working artists whose income, like so many people in our community, has been impacted by the pandemic. The result is a billboard art project that is supported by the Sherwood Foundation, the Lincoln Community Foundation, Lamar Advertising, and we want to just say that 10 visual artists in Lincoln will have their art on a billboard for 4 weeks. And Deb Ahrens, the director of Public Art Lincoln, will join us now via Zoom with more details about this wonderful gift to our community. Deb?
Thank you, Mayor. We're very excited about this project, and this morning released our request for submissions for the Billboard Art Project. As you mentioned, thanks to our generous sponsors, we've secured funding to place art by Lincoln artists in 10 billboards around the city. We are seeking art that includes imagery and text that will unite and support and inspire and bring joy and healing to our community. We also want to support our local artists whose primary sources of income have been affected by the pandemic and the resulting economic repercussions. The selection committee that was convened by Public Art Lincoln will review all the submissions and select 10 for billboard presentations. The selected artists will receive a stipend of $1,000 each. In addition to featuring artwork on 10 billboards, all of the artist submissions, whether chosen for billboard or not, will be featured on the Public Art Lincoln website, which is lincolnpublicart.org. The submissions are due by May 5th, by 5 p.m. on May 5th, and we expect selected artists to receive their stipends the week of May 18th, and for billboards to start going up around the city and for the artwork to start going up on our site around May 27th. The full request for submissions and all the information you would need to submit a work of art is available on our website, again, lincolnpublicart.org. And my contact information for any questions is also available there, and I'm happy to reach out and chat with anybody about it. So thank you so much for letting us share this information today.
Oh, thank you so much, Deb, and thank you to Public Art Lincoln and to the Sherwood Foundation, and the Community Foundation of Lincoln, and to Lamar Advertising again for coming together to support our local artists and giving them an opportunity to earn some income and to show their talents and to brighten our spirits during this tough time. Thank you so, so much. And then finally today, it is another Sunshine Monday. We are again sharing some of the beautiful art created by Lincoln's children as part of the Sunshine Kids for Seniors project. Our Aging Partners Department is helping children connect with our homebound seniors by sending notes and artwork. And if your family would like to participate, please do send your scanned notes and artwork, just first names of children only, to sunshinekids@lincoln.ne.gov. We'd love to share them with our homebound seniors. And with that, I'd like to open this up for questions from the media. With that,
I have a couple from Brent at Channel 8.
We have two questions for the mayor. Has the health department finished its investigation into cases at Smithfield and Crete? What was the result? And then what guidance would you give to people about holding and attending yard sales?
all right, we'll bring Director Lopez back up to answer these questions about yard sales and Smithfield plant in Crete.
As far as Smithfield, we do have a confirmed case, an individual that works at Smithfield, but we have not been able to confirm the source of the exposure of that individual. As far as yard sales, I think at this time we would advise people to hold and not have those until we get through the first part of May and see where we're at with our case count in Lincoln. And we're continuing to work on that. And I would encourage anybody that has questions about that, please, our environmental health area is more than happy to help you work through that and walk through that. If you call the 441-8006 number, we can get you transferred to someone that can really assist you and answer specific questions.
Other questions from the media? I know it's tempting, as so many of us are spending more time in our homes. Going on, there are bags and bags of things that my family has set aside by our front door, and it would be so nice to try to put those together in a garage sale. But as we know, this virus can last on surfaces for hours, maybe even days. And so while it's good to purge and good to have yard sales in normal times, this is probably not the ideal time when that could potentially spread the virus or invite people into your home atmosphere, into your home environment who potentially could be asymptomatic spreaders. It's just not worth the risk at this time. But we do hope that in the future we can get back to the joy of neighborhood tag sales and those special finds and the reuse of treasures that we all have had and like to share. Are there other questions from the media? Okay, well, the dashboard will be available now on our website. Maybe we could just speak to where that link is briefly and make sure that people know how to find it. Is it covid19.lincoln.ne.gov? Okay, there should be a link to the dashboard there where you can monitor the latest information. And again, thanks to our local public health department for making that available, and we'll continue to add to that dashboard in the coming weeks. And thank you for tuning in. We appreciate the attention that you're giving to this, to be informed about how to make smart choices during this difficult moment. We'll see you tomorrow at 3:30.